Every day in the clinic, we meet patients that had cancer or are suffering currently from cancer or cancer treatments, oncology treatments. And the aim of the course is to give you the confidence, the tools, and the abilities to treat these patients, really to relieve their suffering and allow the best results in your clinic. The course covers actually the foundation of cancer, both in Western medicine and Chinese medicine. So understanding what is cancer, understanding also the Western medical treatments. And then it covers in depth the different quality of life which are hindered related to cancer, such as nausea, vomiting, fatigue, hot flashes, etc. And we go into protocols of treatments, understanding research that was successful in this area, and there is ample of research. And with this giving you the best tools and all the different options to treat cancer patients with good results. From my experience, and this is the main kind of motivation behind the course, it's actually not complicated at all. Cancer patients respond very well to acupuncture, and that's why there's been so much research with good results. Even respond well to like relatively simple treatments. And like one of the things we do in the course is go through all the different combinations with stomach 36, for example. And I think one of the most rewarding things in treating cancer patients is that they respond and respond immediately. I mean, many times patients come to my clinic, one way, like tired, suffering, with vomiting, and they go out after half an hour or an hour totally different, full of chi, full of vibrance, full of life, and it totally changes their quality of life, but it's going deeper. Chinese medicine always touches also the relation to Shen. And I think this is, again, one of the things we are emphasizing in the course, because eventually when you touch the Shen and people, when are undergoing harsh treatments or having cancer, there's a lot of fears involved and anxiety. And if you treat them, and acupuncture is, to me, one of the most wonderful way to do it, they immediately feel the difference. And they're coming out, as I said, immediately after the treatment, feeling different and totally to the way they came in. So as I said before, it's very rewarding and not so complicated. There's a lot of fear about treating cancer and cancer patients. And I think one of the main aim of this course is to give you the tools, the confidence, the ability to treat cancer well, and understanding the different protocols and what you're doing, and being confident also that there is a lot of research that supports this very basic protocols to treat cancer, and follow a lot of different cancer, I can say, side effects, especially of Western treatment that we can treat. So you're welcome, you're welcome to try. I think that with the hundreds already of people who graduate the course, the most common kind of feedback that we are getting is that this course is so effective and teaching us so many tools that we can implement immediately to the clinic. When we are studying in this course protocols to treat fatigue, for example, or nausea, or constipation, or hot flashes, they don't just apply to cancer patients, they apply to many patients that you have in the clinic suffering from the same conditions. So really, you're learning a whole new set of tools, or enhancing your own set of tools to treat not just cancer patients, but patients in your clinic. And one of the magical things that always happen, that when you study something, suddenly these patients are coming to your clinic. So even if you don't have many cancer patients now, I know it always happens. It's difficult to explain, but everybody knows it. Once you do a course, suddenly you get patients that kind of are fitting your new set of tools and knowledge and abilities. So even if you don't treat many cancer patients now, I believe that after the course, you will suddenly get many patients who are referred to you patients with cancer or other patients that you're having that will hear about it and will refer to you, their relatives or friends. So this is some kind of a magic that we always see that is happening. I think when you treat cancer patient, it's important to understand the Western medicine from the biological point of view to the treatment and the treatment mechanism, etc. First of all, the patient expect you to understand their medical records. You can later communicate better and fluently with their oncologist or the healthcare providers in Western medicine, and you will understand better different side effects and how they feel. So I think the Western medical knowledge is crucial when we're treating cancer, and it will enable you not just a better communication and a better understanding, but eventually also a better diagnosis in Chinese medicine. So it's a crucial part of the course, and I think it's almost impossible to treat cancer patient without having a good foundations as we give in the course for Western medicine. One of the important visions behind this course is that people all across the world are having the same foundational knowledge and that they can share it. So it's the first specialized course that has been now already. We have graduates from Australia, from Asia, from Europe, from Canada, from the States, more than 350 graduates that have the basic same foundation. So it means they can communicate easily, and we can easily transfer patient or recommend patient. I get almost on a weekly basis a request if I know somebody in Europe or somebody in the States that can treat friends or relative with cancer. So this is it creates an amazing community with the same foundation that can both communicate, refer, and make Chinese medicine much more meaningful all across the world.